first tonight, DFL leaders in the Minnesota legislature are looking to wrap up the 2023 session late next week. A number of bills still haven't passed, including the health services bill, which Mayo Clinic says if passed in its current version, it will torpedo billions in funding for state projects. KIMT News 3's Alec Lasham joins us live from outside Mayo Clinic downtown. And Alec, what do we know so far about the progress of the bill, and is there any idea of any compromise?
Well, Tyler, one of Rochester's state representatives, Andy Smith, tells me negotiations with Mayo Clinic, the Minnesota Hospital Association, and the Minnesota Nurses Association are currently ongoing. Now, Smith says Mayo Clinic is against two provisions in the health budget bill. The first is the Board of Healthcare Accountability, and the second is the Keeping Nurses at the Bedside Act. He adds that Mayo Clinic has focused more criticism on the second measure, which would create commissions at hospitals that would allow nurses to have a say about safe staffing levels. Right now, Mayo Clinic is asking lawmakers to exempt almost all hospitals in Minnesota from the potential law, but Smith says DFL lawmakers are not accepting that. He adds that it's not a matter of if, but when the bill passes and who it will apply to.
Our position is we'd like it to apply to all hospitals in the state, including nonprofits like Mayo Clinic. And as we know from last week, Mayo Clinic doesn't favor that for reasons that they haven't been public with. So we are actively in conversations about it, but yes, I expect this bill to pass this session in some form.
Now, GOP lawmakers like State Senator Carla Nelson say authors of the bill, which includes Smith, should listen to Mayo Clinic's concerns. And Mayo Clinic also says that their concerns with this bill is that if they do go through and it does become law, they will only make staffing challenges more difficult and not easier to fix. Live in Rochester, Alec Lasham, KIMT News 3.
All right, Alec, thank you very much. And in a statement, Mayo Clinic says its Board of Trustees reviewed and agreed on action on a number of items at its regularly scheduled quarterly meeting. But that action is pending outcomes of the legislation session before determining the next steps.